Good evening. Welcome back to another edition of our Stats with Sarah report. My name is Sarah, epidemiologist here with the Jefferson County Health Department, and tonight we will be reviewing the Week 34 data together. The CDC Week 34 consists of data from Sunday, August 16th to Saturday, August 22nd. Let's start off today with a quick recap of our Week 34 numbers. We had a total of 301 confirmed and probable COVID-19 cases in Jefferson County. This brings our year-to-date total to 2,385. We are now reporting 40 COVID-19 associated deaths as of Week 34. The number of outbreaks in our long-term care facilities remain at 15 for Week 34. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in residents or staff. During Week 34, 25 of the 301 confirmed and probable cases were in long-term care facilities, meaning that 276 cases were in the general community. Let's begin, as always, by looking at the table showing the number of confirmed and probable cases by week. Each CDC week begins on a Sunday and ends on a Saturday, so the Week 34 data consists of everything reported to us beginning August 16th, which is the date that is listed in that second column, and tracks everything through the end of the week, which was this past Saturday, August 22nd. This table includes our lab confirmed and probable cases. The lab confirmed cases include those individuals who receive a positive result from a diagnostic test, and the probable cases include those who are a direct contact of a positive case, meaning that they were within that 6-foot distance for 15 minutes or more of that positive case. And they have also become symptomatic since having been in contact with that individual. We saw another slight decrease in cases in Week 34, which is certainly promising. In Figure 1, we see the confirmed and probable cases by week. And for the second week in a row, you'll see that slight decline in cases, which even though it is not a very large decrease, any decline in numbers was absolutely what we were all hoping for. Let's make sure we continue to take all those precautions with social distancing, mask wearing, and practicing good hand hygiene so that way we can keep this downward trend going. The next chart shows a breakdown of the daily case numbers and that 7-day rolling average of cases. The dotted line is the number of daily new cases, which, as you can see, it fluctuates from day to day. That solid blue line is the 7-day average, which helps to smooth out those fluctuations in the data. The 7-day average of cases is also one of the indicators that is used for that color guidance chart for our county. It does appear that our rolling average is plateauing a bit, hovering right around 40 to 45 cases per day at this point. We had that entire month of July where our rolling average was steadily increasing, so it is definitely encouraging to see these numbers moving in the right direction. Next, let's look at the overall age group data in Figure 4. The 20 to 29-year-olds had 56 new cases throughout Week 34. But it is actually our 0 to 9-year-olds that I'd like to bring your attention to this week. Last week, the 0 to 9-year-olds had 56 cases, and this week they're up to 76 cases. While it wasn't the largest increase when we are strictly counting the number of cases, it was the largest percentage increase with a 35% increase from Week 33 to Week 34. For this specific age group, it is a little uncommon to see 20 new cases within a 7-day period, so it is something that we'll be keeping an eye on as the weeks move along. As far as the rates per 10,000 go, our 80-plus age group still has the highest rate. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. This past week, unfortunately, we did have quite a few new fatalities that were reported to us. Most were within that 70 to 79 and 80-plus age group. 11 of these fatalities have been in our general community, and 29 have been within the long-term care facility population. Our cumulative fatality rate is now 1.68%. Missouri currently has a fatality rate of 1.9%, and the United States has a rate of 3.11%. So as you can see, Jefferson County is below both of those. Figure 6 shows the COVID-19 cases by sex, and we see that the majority of cases are continuing to occur in the female population. Week 34, we see that 55% of the cases are in the female population and 45% are in the male population. In figure 7, we have the COVID-19 PCR test results by week, as well as a nice visual of what that percent positive rate is. This data only includes those lab confirmed cases, so the number will look different from our main weekly case count because it does not include those probables. That dark blue dashed line is our percent positive, and as you can see, from week 33 to week 34, it is showing an increase. Let's break down these numbers in table 3 where the actual numbers of positive and negative tests are shown. In week 34, we had 258 lab confirmed positive cases. Our percent positive is currently 11.6. I'd like to mention that the number of negative tests that have been reported for us for week 34 is looking a little lower than what we are used to. So this is a reason that that percent positive might be a little higher, even though we have had less positive tests than the previous few weeks. We do rely on the state to process and report those negative test numbers to us, and there's often a 3 to 4 day delay. It's not uncommon to see that percent positive change for the previous week or two until all those lab reports come through to us. I anticipate that that percent positive will slightly change next week when I show this chart again to you all. So as an example, let's look at last week's percent positive. At the time of our weekly video for week 33, it was 10.6%. We received about 600 more negative tests and also had 2 of these positives drop off our list, most likely because they determined that it was out of our jurisdiction. This caused that week 33% positive to change from 10.6% to 8.6%, which you can see in the chart here. I always keep these numbers as updated as possible in order to be as accurate as we possibly can. So small fluctuations in the data should be expected as more reports come in. Here in table 4, the COVID-19 cases are divided up by race and rate per 10,000 residents. The Black population in our community currently has the highest rate per 10,000, and the white population in the community has the highest number of cases with 1,922. As a reminder, we do not include any missing or unknown race data when calculating these rates. For our zip code data this week, I tweaked our graph just slightly to show an additional piece of data here in figure 9. We can now see the cumulative number of cases by zip code as well as the active cases by zip code. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation period. Cumulative cases are shown in blue with a specific number of cases listed above each bar, and the active number of cases are shown in orange. Arnold 63010 has the highest number of both cumulative cases as well as active cases in the community at this point. Next, let's take a look at the cases by zip code per 10,000 residents. The rate per 10,000 takes the population of each individual zip code into account. This helps to give a more fair comparison of some of those areas that may have higher populations or smaller populations. As you can tell, many of our areas have a very similar rate per 10,000. The cases look much more evened out when we look at the rates, and 5 of our zip codes are actually showing a very similar rate right there around 120. For our hospitalization data this week, we are once again going to take a look at the data we received directly from our local hospital systems. We are currently receiving information from BJC and Mercy and are actively working on receiving data from SSM. As of week 34, a total of 141 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 24 of these patients have been admitted into the ICU, and 8 positive COVID-19 cases required ventilators. In figure 2, we see these hospitalizations by age group. The hospitalizations that are counted are going to include everything from an emergency room visit to those who are admitted as an inpatient. Each one of our age groups has experienced at least one hospitalization, the highest number being in that 50 to 59-year-old age group. We are seeing more hospitalizations in those older age groups, but as you can see, there have been a few hospitalizations for our younger groups as well. Take a look at the 20 to 29-year group, which shows 18 hospitalizations, including those emergency room visits. This data is not fully complete, as it only consists of information from 2 out of the 3 main hospital systems around the area, but it does give us a pretty good indication of how many of our residents are seeking medical treatment because of this virus. Next, we'll take a look at the length of hospital stay. We have had a cumulative total of 55 emergency room visits, which is a sign that those individuals have experienced symptoms that were severe enough to seek help. There are currently 15 Jefferson County patients who are still in the hospital at either BJC or Mercy facilities. And we are seeing the largest number of our hospitalized residents staying in the hospital for about 7 to 14 days. Our last report, once again, will be reviewing the current school-aged population data. As of week 34, there have been 260 total lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. Let's break down this number here in the next few slides. In figure 1, the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group is shown. During week 34, there were 50 cases reported for the 0 to 19-year-olds, which is the most we have seen for this age group so far. In figure 2, we split these cases up by zip code. Just like our main weekly report for zip code cases, I've added that number of active cases in orange for each zip code. The dark blue is the number of cumulative cases for each area. The Imperial area has had the most cases so far with 58 total cases in the 0 to 19-year age group, and 19 of those cases are still active. Our previous numbers have indicated that the majority of the 0 to 19-year age group cases have been in our high school age students, as shown here in figure 3, where we've divided up the cases by age-based grade levels. This past week, there were 10 new cases in the pre-K group, which is the 0 to 5-year-olds, and 10 additional cases in the elementary school group, which are those 6 to 10-year-olds. This is higher than we are used to seeing for both of these age groups. So we have been working very closely with the school districts in our area for quite some time now, and we'll definitely continue to report any changes in these numbers as the first few weeks of school progress. That's all we have for today's stats. Thank you to everyone for tuning in and working hard to stop the spread of COVID-19 in our community. Stay safe and healthy and have a great rest of your week.